Okay, so we will discuss about the phosphate handling. Okay, uh, so phosphate is abundant in the body and is an important intracellular and extracellular ion, but is predominantly intracellular. About 65% of the dietary phosphate is absorbed mainly in the duodenum and jejunum by a transcellular process which is enhanced by vitamin D. Okay, phosphate is abundant in the body and is important intracellularly and extracellular anion. Okay, but is predominantly intracellular. About 65% of the dietary phosphate is absorbed mainly in the duodenum and the jejunum by a transcellular process which is enhanced by the vitamin D. Okay, we have seen earlier that the vitamin D cause the absorption of the phosphate and calcium in the small intestine like the duodenum and the jejunum. Calcium and phosphate precipitate to form the insoluble calcium. Okay, calcium phosphate. Okay, precipitate to form the insoluble calcium phosphate, and their concentrations in the blood are close to the saturation point at which calcium phosphate complex precipitate out of solution onto the bond matrix. Therefore, an increase in the one of the ion result in the precipitation of the some calcium phosphate, and thus some of the other ion is removed from the solution. Calcium and phosphate concentration are thus inversely proportional. Okay, it's not very important. Then we will see the renal phosphate handling. So unbound phosphate is filtered freely at the glomerulus, and there is reabsorption along the nephron. The maximum rate of reabsorption is limited, and excess filtered phosphate above the threshold level is excreted. Okay, unbound phosphate is filtered freely. Unbound phosphate is filtered freely at the glomerulus. Okay, unbound phosphate is filtered freely, okay, at the glomerulus, and there is the reabsorption along the nephron. The maximum rate of the reabsorption is limited, and uh, excess filtered phosphate about above a threshold level is excreted. Of filtered phosphate, 80% of the reabsorbed and in the proximal tubule by the transcellular process. The distal tubule reabsorption further 10% of the filtered phosphate, and in the collecting ducts it is about 2 to 3%. Okay, so maximum reabsorption occur in the proximal, then the distal, and the collecting duct. Phosphate renal excretion is regulated by the parathyroid hormone. Increase excretion by inhibiting the reabsorption in the proximal tubule, then activated vitamin D. This cause decrease the excretion by increasing the reabsorption in the distal tubule. Then acidosis increase the excretion, glucocorticoid increase the excretion, and the calcitonin increase the excretion. Only the vitamin D cause the reabsorption of the phosphate. The parathyroid hormone, acidosis, glucocorticoid, and the calcitonin will increase its excretion. Now, pituitary gland. Okay, the anatomical location of the pituitary gland. Okay, here is the we can see there. This is the hypothalamus. Okay, this is the infundibulum, and below this is the pituitary. This is the anterior pituitary, and this is the posterior pituitary. Okay, and this is the sella turcica in the sphenoid bone. So, anatomical location, the pituitary gland lies immediately beneath the hypothalamus in bony hollow of the sphenoid bone, the sella turcica, and it is covered by the fibrous diaphragm sella of the dura mater. Uh, the optic chiasma lies directly superior to the anterior pituitary. Okay, optic chiasma lies superior to the anterior pituitary, Here is the optic chiasma. Okay, the posterior pituitary is connected to the median eminence of the hypothalamus. Okay, is connected with the medial eminence of the hypothalamus by the pituitary stalk, also known as the infundibulum. Okay, the cavernous sinus, including the cranial nerve 3 and 6, okay, lie lateral to the pituitary gland. Okay, lie lateral to the pituitary gland. The cavernous sinus and pituitary gland is primarily divided into two subglands: the anterior pituitary, uh, the adeno hypophysis, and the posterior pituitary, the neurohypophysis. Okay, so you will see the anterior pituitary. The anterior pituitary gland, anterior pituitary hormones are released under the control of hypothalamic releasing or inhibiting hormone. Anterior pituitary hormones are released under the control of the hypothalamic releasing or inhibiting hormone. Okay, from the small neuron with their cell bodies in the hypothalamus and released into the blood at the median eminence. Okay, and the small neurons with their cell bodies in the hypothalamus and released into the blood at the median eminence. This hypothalamic hormone are transported directly to the anterior pituitary via the hypophyseal portal vessel and act to stimulate or inhibit the release of anterior pituitary hormone by activation of receptors on specific group of pituitary cells. Okay, the anterior pituitary gland is it's in stimulated or inhibited by the hypothalamus. Okay, the anterior pituitary hormones and the hormones released by their target organ, okay, inhibit further release of the hypothalamic and the anterior pituitary hormone by negative feedback. Okay, as the anterior pituitary hormone will release, or the hormones which are stimulated by the anterior pituitary will further have negative feedback inhibition on the hypothalamus and the negative and the anterior pituitary. Okay, the following hormones are secreted from the anterior pituitary. They are follicle stimulating hormone, then the prolactin, then thyroid stimulating hormone, adrenocorticotropic hormone, luteinizing hormone, and the growth hormone. Okay, follicle stimulating hormone and prolactin, FSH, then prolactin, then the TSH, ACTH, luteinizing hormone, and the growth hormone. Okay, FSH, prolactin, ACTH, luteinizing hormone, uh, adrenocorticotropic hormone, and the growth hormone. This can be remembered using the mnemonic fresh pituitary taste, almost like guinea. Guinea. Okay. Fresh pituitary taste almost like the guineas. Okay. Fresh pituitary taste almost like guinea. Then posterior pituitary. So the posterior pituitary gland secretes two peptide hormone. These are the oxytocin and the antidiuretic hormone. So from the anterior pituitary, there are so many hormones that fresh, uh, fresh. What was that? Fresh pituitary tastes like guinea. So fresh, that means FSH. Pituitary means prolactin, then pituitary taste, thyroid stimulating hormone, then like LH hormone, then almost means anti adrenocorticotropic hormone, and guinea means growth hormone. Okay, and in the posterior pituitary only secretes oxytocin. Okay, oxytocin and the ADH. The posterior pituitary is a really direct extension of the hypothalamus. Oxytocin and the ADH are manufactured in the cell bodies of the large neurons in the hypothalamus and are transported down in the axon of the cell to their terminals on the capillaries originating from the inferior hypophyseal artery within the posterior pituitary gland. When these neurons are activated, they release oxytocin and the ADH into the general circulation, from when where they can reach the relevant target tissue to produce their required effect. Antidiuretic hormone is controlled by the negative feedback mechanism based on the plasma osmolality and the blood volume. Oxytocin, however, is involved in the positive feedback mechanism. Okay, ADH is having a negative feedback mechanism by increase the osmolality and the blood volume, and oxytocin has the positive feedback mechanism. As oxytocin increase, it further increase the prolactin and will further increase the oxytocin. Then pituitary hormone dysfunction. So pituitary hormone dysfunction. So in this, ACTH, TSH, FSH or LH, and the growth hormone and the prolactin, ADH, and oxytocin are there. Okay, so ACTH is stimulated by the chronotropic releasing hormone, inhibition by the cortisol. Action of the ACTH is the acts on the adrenal cortex to stimulate release of glucocorticoid, which regulate the metabolism and stress response. Okay, clinical excess is the Cushing disease, and clinical deficiency, if there is the excess and if there is the deficiency, will cause the Cushing syndrome. If there is the excess and if there is the deficiency, will cause the secondary adrenal insufficiency. This is the ACTH, which is released from the anterior pituitary. Then the TSH also released from the anterior pituitary. The activating stimulating hormone is the thyroid receptor, thyroid regulating hormone, and the inhibiting hormone is the thyroxine. What is the effect of the TSH? TSH act on the thyroid gland to stimulate release of the thyroid hormone, which regulate the metabolism. If in the excess, it causes secondary hyperthyroidism, and in depression, it causes the secondary hypothyroidism. Then third one is the TSH, or TSH and FSH and the luteinizing hormone. Okay, they are also secreted by the anterior pituitary. The stimulating hormone is the gonadotropin releasing hormone, and the inhibiting are the prolactin and the estrogen or testosterone. Okay, its effect is act on the gonads to stimulate production of the estrogen or testosterone and production of the egg and sperm. Okay, its excess will cause the infertility, and its deficiency will cause the gonadal insufficiency. Then growth hormone. It's also secreted from the anti-pituitary. Its stimulating factor is the growth hormone releasing hormone, and inhibiting factor are the somatostatin. It acts on the liver, bone, and the muscles to stimulate production of the IGF, which stimulate body growth and higher metabolic rate. Okay, in excess, it causes acromegaly in adults and gigantism in the children. Okay, acromegaly and the gigantism. Okay, and in deficiency, adult growth hormone deficiency syndrome in the adult, or dwarfism in the children. Okay, then prolactin. It's also secreted from the anterior pituitary. Prolactin, the stimulating factors are the prolactin releasing hormone and the thyroid releasing hormone, and the inhibiting factors are the dopamine. Okay, it acts on the mammary gland to promote milk production. In excess, it causes the hyperprolactinemia, and its deficiency will cause the failure of postpartum lactation. Then antidiuretic hormone. It's released from the posterior pituitary Its aggravating factor is the raised plasma osmolality, and the inhibiting factor are the low plasma osmolality, alcohol, caffeine, glucocorticoid, and the atrial natriuretic peptide. Okay, it acts on the kidneys to promote water retention, and on the vascular system to cause the vasoconstriction. Okay, its excess will produce the SIAD, syndrome of inappropriate antidiuretic hormone. Uh, okay, and in deficiency it causes the central diabetes insipidus. Okay, then oxytocin, it is also secreted from the pituitary, posterior pituitary. uh, in it's stimulated by the stretch receptor in the nipple and the cervix. Okay, and it's inhibiting factor at the stress. Okay, it acts on the female reproductive system to trigger uterine contraction during the childbirth and milk ejection during the sucking. Okay, there is the no excessive or inhibit or any negative effect. Then anti-pituitary hormone, ACTH, TSH, FSH, growth hormone, as we have seen, prolactin, pituitary, there is the ADH, and the oxytocin we have seen just now.